Surviving Sepsis is a production of the IPRO QIN-QIO.
As a fireman stationed at the Albany, New York airport, Josh Woodward knew how quickly a fire can spread, ravaging everything in its wake. But he didn't know that sepsis could spread just as rapidly and be just as deadly. A fire often starts with a small spark, and that's how Josh's battle with sepsis began. As the infection spread undetected throughout his body, it affected his vital organs and extremities. After 6 weeks in the hospital and months in a rehab center, Josh returned home as a double amputee lucky to be alive. I'm Patrick Archambault with the IPRO QIN-QIO. In this series, Josh and his wife Chelsea share their story in the hope that it will raise awareness about the danger of sepsis, the effect it can have on individuals and families, the unexpected hurdles that patients face, and the importance of resiliency and overcoming these challenges. So Josh, what would your message be to the public regarding sepsis?
I guess just to reiterate, you don't have to be a doctor or a nurse to really know what to look for. Mm-hmm. Spend a little research online, and luckily you're listening to this podcast. Hopefully you have some perspective from it. For me, I keep going back to, what if I had just put the science together of that fever with that foreign thing going on in my body? If I had just connected that early on, it could be a much different situation. Never hesitate to get stuff checked out. No one's going to laugh at you. No one's going to make fun of you. This is your body. This is your life. It's your family. You do what you need to do to keep you healthy. So if something feels off, don't hesitate to get it checked out. You don't have to go into panic mode initially, but just, take those precautionary steps.
And what would you like to say to the healthcare community regarding sepsis?
Thank you. I think that's probably the first thing I could say. I just, sometimes all the pieces come together and all this is really bigger than me, and I don't really know how to make sense of all of it, but the right people receive the right training and were put in the right place at the right time to, allow me to survive. And anybody who's ever taken care of me, sewn me up, cut me up, fed me, you name it, throughout this whole process, from the surgeons all the way to the ER techs and to the people who transported me, to and from hospitals. Thank you. That doesn't even feel like a big enough phrase, but it's not unnoticed, and my hat's off. I think these are superheroes, really. And gosh, thank you for just relying on your training and taking your training seriously. Yeah. I don't need to tell a doctor or a nurse how to do their job, but I'm very fortunate that I had the people around me that I did. And you know what? Sometimes you get the right people around you. Sometimes you get the best trained people and you get all of that. And sometimes it still doesn't work out. Sometimes people, they still pass away. And all that is just, it's above my pay grade. Again, I don't understand it, but at the end of the day, I'm just, if nothing else, grateful that I'm still here, and evidently I still have some work to do. It's not my time yet. I've really, really been humbled by the whole process. So,
Chelsea, what would you say to the medical community and the public regarding sepsis?
I think everything that Josh said, I'm going to piggyback and say thank you. He got so lucky. We had the best caretakers in the realm of education. However, I think something, we keep talking about this fever right? And could it be sepsis? I think a really good question that healthcare providers could ask their patients when they're feeling unwell in general is, have you had an injury recently? Do you have any cuts or anything like that going on? Because those two connected could be, as we've seen, something much bigger. The nurse who saw him took a pen and drew on his arm and then came back and noticed very quickly. And that was excellent procedure for checking on him. We're so thankful because she's the one who escalated everything to go really quickly. So I think to the healthcare providers, I think sepsis is no joke, and we've seen, a very rare case of it, but even at a lower level, it is still a very serious situation. And so being informed and asking yourself, could this be sepsis, I think could save a life.
Surviving Sepsis is a production of the IPRO QIN-QIO. Special thanks to Josh and Chelsea Woodward. Producer-host Patrick Archambault. Executive producer Teresa Jacobellis. Executive producer Sarah Butterfield. Video recording and editing Louis Cerritos. This material was prepared by the IPRO QIN-QIO, a Quality Innovation Network quality improvement organization, under contract with the Center for Medicare and Medicaid Services, CMS, an agency of the U.S. Department of Health and Human Services, HHS. Views expressed in this material do not necessarily reflect the official views or policies of CMS or HHS, and any reference to a specific product or entity herein does not constitute endorsement of that product or entity by CMS or HHS.